this conversation is really being sparked by a young lady that was in Amber's live earlier that was talking about some of the side effects and things that she was experiencing. And she wanted to mention it, but she was nervous about bringing it up because she didn't want to offend or scare or fearmonger anybody about getting started on this journey. So this is why we're talking about this tonight. I was able to pull a few evidence-based articles about the topic and just some topics from different websites, verifiable information. Let me say it like that. If you are new to me, my name is Kima. I go by AskNurseKima. I'm a registered nurse. I'm a certified case manager. Honey, I work GLP1s, vision changes, and blindness. We're going to hit this topic from two points of view, from the eyes of the diabetic and from the space of a non-diabetic. So if you don't know, I am a stroke survivor. I am not a diabetic, but honey, I am a stroke survivor, and I am fighting this journey to beat chronic obesity. You see some of my stats listed up there, my highest weight, the weight I was when I started on this journey, and my current weight. You have extreme constipation, help. Listen, let me tell you what you can do. Get you some yellow dragon fruit if you don't want to get meds first. Yellow dragon fruit, prunes, extra fiber, bena fiber. If those things don't work, baby, get you a natural good cleanse like Mag 07. That was my go-to girl, Mag 07, and me definitely locked in. Hey, Jalen, welcome in. Thanks for the repost. If we can take a moment to repost this live out, share it to your stories, to all your friends, honey, so we can talk about it. Listen, I am an Amber patient and partner. And even though I do talk about it, do not be afraid to share this live with other creators and friends that may be affiliated with another company, because this is about community, not necessarily the telehealth. This is about community, how we can all help each other, because we all started in the beginning, same journey before we became affiliates with, whatever company you are with. So this is just about knowledge and education, nurse-led education that I'm providing to you free of charge right here on this platform. Okay. So let's get into it. I'm going to be on about an hour, but I am going to have Amber come up, because I definitely, if you don't know Amber, I want her to be able to come on the screen and share her journey. So Amber, I'm putting you on the spot, honey. I want you to come up and share your journey, the things that you have done, what's working for you, and give your story, okay? And I'm going to have Ms. Red come and do the same thing as well. You provided a space for me, so I definitely want to provide a space for you as well. So tirzepatide, the active ingredient in Mounjaro, is what I take, okay? I started on brand and transitioned to compound. Right now, believe it or not, today, y'all, was my first injection doing... It's like 17 units. It was like 1.5. That's the lowest I've ever taken, because I am in maintenance and I'm really trying to stay low. Okay, so the GLP1, GIPs, the dual agonist. So that's what we're talking about. Let's see who's here. Hold on one second. Okay. That's what we are talking about in this live. Thank you, Miss Amber, this evening. So, because... and I don't see Miss Red here just yet. I haven't seen her. So Amber, if you see her, let me know. Okay. Side to side, if you see, is it just Miss Red?
It's red. I think it's 1D and then 2 Ds.
Okay. Side to side, Rocio, Tamika, Kendall, if you see her, send her a request for her to come up. If you all see her. So we're going to talk about like the health issues. So from a nursing perspective, when we have patients that have been diagnosed as diabetic, there are certain exams we recommend that they get, annually. One being the eye exam, to test for diabetic retinopathy. We like to have your feet checked so you can check for diabetic neuropathy, nerve pain. So when I have heard people talk about, they've had some vision changes being on this MED, the first thing that come to my mind, which is what Amber brought up, she asked the young lady, hey, are you a diabetic? Which I absolutely love that you asked that question, because that's what I was thinking. Because sometimes you can have vision changes as a diabetic when your sugars are not within range. So that being said, I did pull some articles that talks about vision changes when people take GLP-1s or being diabetic, okay? Hey, Mama, what's going on, Mama G? Welcome in. So, there are the risk factors that we just recently briefly spoke of when it comes to being a diabetic, when it comes to eye changes, because all of those things come into play as your sugar improves. But if it continues to increase, you run into that chance of having diabetic neuropathy, retinopathy, and which is why we encourage our members to go and get checked. But we also encourage you to check your blood sugars on a regular basis every day. And depending on your doctor's recommendation, you may have to check it 3 times a day. It might be twice a day. It might be, you might be on a sliding scale, different insulins, just depending on what your A1C was when you were diagnosed. Diabetic and vision has gotten better. No nerve damage from your annual vision visits. Thank you. That's Harris Girls. Thank you. Hey, Kay's Wellness. Welcome in, friend. And that's important because the goal of GLP1s, GIPs, is to improve, of course, your blood sugar and how your body uses insulin. You know, it's an endocrine medication to improve that outcome, to lower your A1C so that you will become normal and within range, and your diabetes can go into remission and control. Okay, so that is the goal, but we also have to be truthful with ourselves. Okay, when we are diabetic and we're on these MEDs, if we have other comorbidities, what else do we have going on that may be a factor into why we're having changes with our vision? You know, whenever I hear a patient tell me, hey, I'm taking this medication, Kima, this GLP-1, and now I notice that my vision is blurry when I wake up in the morning. My first question is always to ask, well, when did you start the medication? And had you noticed any vision changes before starting the medication? Because we want to figure out, is it really the MED? We're trying to get down to the root cause of the changes that you are experiencing. And unfortunately, when you are diabetic, you can have vision changes that you be rationalized and normalized because it happens so frequently. But then once you start taking this new MED, you will automatically attribute, and I'm not saying all people, all patients, I'm saying this just happens. I've experienced this. You will say, oh, it's because I'm taking this GLP-1 that I have these blurry, my eyes are blurry. I'm having these vision changes when you may have been having these changes before, but just really did not pay close attention to it because you normalize it as, oh, this is just what it is today. Maybe my sugar's up, maybe my sugar's down. So we want to get into that. And Miss Amber, I want you to give the people in the chat, there's 69 people in the chat right now, your story, because you and I met, I don't even know if it's been a couple of weeks. I feel like I've seen you before. Yeah. So I want you to tell the people in the chat, you know, who you are and how you got started on your journey while I pull up this evidence-based article I found.
Awesome. So first thing, Miss Red, she is in the chat, and I think they asked her to come up because your mods can't request her. So Red, request up when you get a chance. But what's up, everybody? My name is Amber, and I go by the Amber Effect. I am in Houston, Texas, and I started this journey 9 months ago, specifically Thursday, May the 29th, 2025. And I had gotten to my highest weight ever. In 2 weeks, or maybe 17 days, I'll be 47 years old, and I have 2 adult kids. And even in pregnancy weight, you know, I didn't weigh what I weighed a year ago, or almost a year ago, whatever. So had been having conversations. I knew that I was getting bigger, right? And I mean, I knew it, I could see it. A lot of it was versed in kind of COVID, you know, there's perimenopause and all of those things that had started to set in and whatnot. Doctor had a conversation. We tried initially with insurance. It did not go through. Fast forward maybe 2 months after that, went back for some follow-ups. She gave me the option, or she told me about Lilly Direct Self-Pay. At the time, I am self-employed. I work for myself, and I had it. And so I was like, you know what? Let's try it. Didn't have any real expectations or anything like that, but I knew I needed to do something. So let's try it. I did that. And so now we fast forward to, what is this, January, almost February of 26. I started at 334 potatoes. I am 257 and some change. So down, 76.4. And I feel good. I mean, I feel good. My knees feel good. My back feels good. I look good too. I'm just saying, I'm going to throw that out there. And I mean, I've just really enjoyed everything, really coming full circle and learning how to, what food is and, what we should be doing. I come from, I don't know, some people maybe the same kind of African American family. Listen, what you get on your plate is what you eat. Now, I did grow up toward the end of all of the grandkids, so people was tired by the time I came around and stuff like that. So I kind of had some leeway, but listen, they still wasn't playing with me, right? And it was just like, I relearned food, and I'm still relearning, foods, trying to figure out things that I can eat. And so being on and just being on live, period, I don't have an issue being on live. I will share, I'm a radio personality, and that's my profession and everything. So just being able to kind of talk with people, help them, encourage them, which is why I created the Amber Effect. So thank you so much. And when the young lady jumped in earlier on my live, and initially she was talking about she thinks she's going to go off. And I was like, being a little nosy, didn't want to be too intrusive and, kind of tell me why. And honestly, when I was, just really trying to figure it out, when she started talking about diarrhea, I was like, oh, I don't know nothing about the diarrhea piece or whatever. But when I saw that you had jumped on, and that's kind of what facilitated this whole conversation. So thank you so much for letting me introduce myself to your people.
Absolutely. Absolutely. Hey, Miss Red, how are you? Lady of the hour, how are you?
I'm doing fine. How are y'all going on tonight?
Very well, very well. So this is the young lady that sparked the conversation that we're having tonight, where we are talking about GLP-1s and vision changes. So I know that being that we have guests on the panel, you can't see the topic that I had posted, but for everyone that's in the room right now, if you're new, I'm Kima. I go by AskNurseKima. This is Amber and Miss Red, and I'm a registered nurse. I've been on the GLP-1 since 2022, and I come on to share this journey. So tonight's topic was created in Miss Amber's live by a question and conversation dialogue initiated by Miss Red. So I did find an article from JAMA. Oh,
I'm sorry about that. That's my grandbaby in the back. She won't be quiet.
Oh, you fine. Hey, baby. So I pulled an article, a couple, because a lot of things, believe it or not, this community, GLP-1 community, we strike up a lot of conversation being on social media that gets out to, the world and different news outlets and things of the sort. So I saw something from the New York Post that talks about how the articles are being created based on conversations that we're having on social media about MJ and other GLP-1s, causing blindness. But I pulled a report from JAMA, something we use, evidence-based practice articles. I am a nurse practitioner student, so I'm tapping into some school right about now. So they mentioned clinical trials where there were people, non-diabetics and diabetics, that on the clinical trial that noted changes with their vision, but there was no direct indication that the medication caused the changes in the diabetic and or the non-diabetic. Okay. And that's clinical trials specifically on MJ. Specifically, I'm talking about MJ because that's what Miss Red, mentioned to us. And of course, it works out for me because that's the med I was on as well, or that I currently take. So let me say, we're not giving medical advice, anything like that. This is just nurse-led education, and we did a little digging to be able to help our good sister, Miss Red, out here. So Miss Red, let me ask this question. And if I ask you anything that makes you feel uncomfortable that you do not want to answer, please just let me know, because this is not in a space to create for you to be uncomfortable. Okay. So this is only if you want to talk about it. If you be like, hey, Kimmy, that's a bit much, we can talk offline. That's cool too.
That'd be fine.
Okay. So I'm gonna go ahead and let you have the floor, because what I like for you to share is what you started to notice that made you have a conversation with your provider.
Okay, I'm gonna start off with before I got on the GLP-1, I was at weight was 303. I noticed that I was having heavy breathing. I was catching myself snoring. You know how you wake up all of a sudden you can hear yourself snoring at night. I was doing it. A little through couple walks, I would get tired, out of breath. Not gonna lie, I had 2 eye surgeries, so I was having eye situation,
Okay.
but it was getting better because when I went back to my eye surgery, he had to put a tube in my eye. So therefore, the tube was, my pressure was going up so much that my eyes would literally would be red, and you would think that it would be my blood pressure. It would not be my blood pressure. But once he put the tube in my eye, my sight came back, pretty looking good. I could see, but just couldn't see like how others see.
Mm-hmm.
So I decided, me and my friend, we decided we was gonna go on the GLP-1, to get something to weight, down.
Mm-hmm.
I started notice little stuff here and there. So when I got on, I was like 303. Then I dropped all the way down to I want to say 270. That's when I started notice the blurring, constant the diarrhea, the passing gas, the sulfur burps. So when I went to my doctor, I was telling her about the issue that I was having, but I never did, mention to her about the vision problem, because I was like, how something with it ain't really what it is. That's how I was, but she was constantly going up on it. So when I got down to 264, that's when everything just hit all at once. Blurry started, getting real heavy. I was waking up like 3 o'clock in the morning, can't see nothing. Black dots. Sometimes if I'm just looking, it's just like in my eyes, like blurry, like black stuff all in my eyes. I talked to my friend about it, and I told her that about the situation. She was like, "Yeah, I think you need to consult in your doctor." And she was telling me once I have the sulfur burst, do she recommend me something for it? She was recommending, pills and stuff for the sulfur burst and the acid reflux, all that, but that wasn't doing it. And then I started notice that my stomach will have the pain was so, it's like, have you ever just ate something and I can't even describe the pain because it was just so bad.
Mm-hmm.
I went to another doctor for that. She told me what it was, like a kind of disease for it. She said it could have been me just shooting myself in the stomach, but she didn't, basically couldn't tell that if it came from the medicine or anything. She just got me some meds for it, but I have to keep back coming to her because I went to her yesterday. She had me blow into a container just to see that I still have it, because she would treat me for that. But it was just, I don't know if the base just the end of the story. I don't know if it's the medicine just tricking it off, or my body done got used to it and just throwing it. I don't know right about now, because right now I'm just totally confused, and I just need somebody just please tell me something. I went to my eye doctor yesterday. I couldn't see him because it was issue going on with my vehicle, so I have to wait until next month to see him. So right now I'm like, I'm scared. I don't know, should I stop the medicine until I see my eye doctor or what?
Okay. So I have a couple of takeaway points from what you said. Number one, you've had an eye surgery before. So my good sisters in the chat, I see another nurse practitioner in here. I mean, for all the nurses or NPs in the chat, drop me a heart. Let me know where you're at. And Keisha made a very valid point. He was releasing the ocular pressure in your eye, which is one of the things that, of course, a diabetic patient typically can have. Okay, is
Okay.
that nerve pain and pressure in your eye. Now, the second thing that I noticed, you didn't tell me what the dose is, but you said she kept going up. She kept going up. So correct me if I'm wrong. When you said she kept going up, are you referring to your doctor kept increasing your dose?
She kept increasing the dose, and right now I'm on 12.5.
Okay.
When I went to her last time, she was trying to put me on the 15. I told her no.
Okay. So again, my experience, not medical advice at all. Why did she decide that you needed to go up on dose? What was the reasoning, rationale behind that?
I don't have no clue, but I know
Okay.
the last time she put me on a 12.5 because the 10 wasn't doing it for me. Because the
When,
10 was bringing the hungry noise. And I was
okay.
eating more with the 10.
Okay. Now we talking. Now we talking with cooking with Crisco. Okay. So it sounds like she's treating you for chronic obesity and not your other comorbidities. Not saying that obesity is not a priority, but if you are a diabetic and you have already had a eye procedure, one or two, as it relates to ocular pressure in your eye, those are the priorities, in my opinion. Now, there are other nurses in the chat might disagree or might, agree, but in my opinion, because I don't know what your A1C is, but in your case, I would think that your dose would not be increased unless every 3 months when she went to do your A1C was not dropping and it was actually going in the opposite direction. Kelly is asking in the chat, what your blood sugars running, your blood glucose and blood pressure?
The day before yesterday when I went, she said it was good. My blood pressure was good and my heart rate was good.
And when you check your blood sugars, like when you took your blood sugar today, what was it the last time you checked it?
Oh, the last time I checked, I can't even tell you. Because I be so busy moving, I just forget about checking it. And I just, for some reason, I just keep having brain fog. Girl, it's just
Miss
my mind
Red,
be.
I want you to see how. So what I do know, this conversation is starting here, but what I do know is going to definitely carry on. Okay, it's going to definitely carry on off this screen because I can already tell we got a lot to talk about. I might have to
We
conference
do,
call
and
in
I don't
my
want to scare
friends.
no. I don't want to be one that scare people that trying to get on the
No,
GLP1, and then they be like, "Oh no," because I heard Miss Red saying it, and I'm scared. I don't want to scare nobody because
no.
everybody's body is different.
Correct. Everyone's body is different and everyone has a different medical background as far as medical conditions, right? So even though you are experiencing what you have a few other things going on and I don't even have the whole picture. I hear GI, I feel something with your eyes. I feel like that. We already know endocrine with diabetes. There's a few things going on that I feel like are contributing to some of your issues that you have, not necessarily just falling on the GLP-1, but I do think you on a too high of a dose based on what you got going on. But again, that's just me.
And
Somebody
I
said
feel
in the
like that
chat you
too.
need another doctor. Yes.
That's the reason why I'm going to another doctor, because the doctor, she don't give me, she real good. It's like, but when it get down to personal stuff, I hear you, but I don't hear you.
Mm-hmm.
And at the end of the day, this is my body, and I don't want to lay down and not wake up because you don't put me on a high dose. And when I was trying to explain it to you, it went out one ear.
Correct.
So my life more important than trying to take meds. And so that's why I was talking to the other lady. I'm thinking that I need to either get another doctor or I'm just going to do the sleep.
Well, I definitely feel like you need another doctor. I don't know if with your insurance plan, look, let me put on my other hat. With your insurance plan, if you have an option where they have like these providers that'll do like second opinions, they'll look at your medical records and tell you, what your options are. If you have such a plan, if you have case management as far as your commercial insurance plan, ask them if you have a benefit to have a second opinion through like an outside vendor, somebody that's a part of your employer's plan. If not, we can have a conversation, and maybe I can try to help you find another provider in your
Right.
area.
Because I really want to
Okay.
have a deep conversation personal with you offline. Because I don't want to,
Yeah.
tell it out online and then,
Yeah.
scare other people. So
Yeah, I
I'd rather
understand.
do that.
And we can do that, and we definitely can do that. So I definitely appreciate you being transparent and vulnerable enough to come up and to share with all 90 something people that's in the chat, because God knows how many people in the hallway that's listening that's not in here. So I thank you for that, because that takes courage. But like you said, you want to be able to help somebody else just in case someone else is experiencing the same things that you are
Right.
experiencing. Okay. So thank you for that. Is there anything else that you would like to share before I drop you down?
No, but just on a that, and on a thing that was good concern me, the stomach, part, because when I take my meds and my stomach be bloated real bad. And I had told her, I said, well, I'm losing the weight. And I said, only thing is not going is my stomach. And I said, it just hurts so bad. And the only thing she can tell me is that would be the last thing to do.
Are you rotating your injection sites?
I rolled it from left to right, and my legs left to right, on my legs left to right, in my arm, and left to right on my stomach.
Now you in one arm you see how big my arm is. You know how many times I can rotate around up in here on this one arm, and how
I
many
said I
times
didn't
I
know
can
that. I didn't know that.
okay. Yes, we have 4 quadrants in our belly, but even in them 4, you mean that times I can move that needle around in my right upper quadrant. Okay.
See, I did not
So
know that.
that's okay, because we learning. That's what we do. Each one teach one. You know what I'm saying?
Right.
But yes. Keisha, hey sis. Welcome
Hey
to the
girl,
chat.
listen,
Uh-huh.
this conversation is so good, girl. I had to go creep in. Girl, I'm in a closet. I'm in a closet because I wanted to say something about the ocular issues that
Mhm.
patients have when they are taking GLP-1s, and because a lot of people are talking about vision changes when they take GLP-1s. And one of the main things that I want to say is, according to clinical studies and trials and evidence-based practices, GLP-1s do not cause patients to have issues with their eyes. 9 times out of 10 is a already existing issue that patients have. And when you take a GLP-1 medication, sometimes it'll cause vision changes indirectly. For example, rapid weight loss can cause you to have visual changes. A patient that has diabetic retinopathy, you can have issues with vision changes. If you, like, say for instance, I'm trying not to get too much in medical terms, but if you think about being in a body that has a metabolic issue already, cardiovascular disease that can cause visual issues, like high blood pressure can cause visual issues. Of course, elevated blood sugars can cause visual issues because of the sugar, the sugar levels that cause a deterioration of the nerves for your eyes, right? So one of the biggest problems I feel like patients who start having issues after they take GLP-1s is, first of all, a lot of patients don't go to the right doctor to be prescribed these medications, so that they are monitoring things like vision changes that can happen when you take a GLP-1 medication. And patients are not always upfront and honest with their doctors when they're trying to get GLP-1 medications, because a lot of us are desperate and we just want to lose the weight, which is very understandable. But like you had said earlier, Kima, the most important thing is getting things that are uncontrolled in control first before you start taking things like GLP-1s that can indirectly cause you to have other issues like ocular changes. So if people do their education, because you're supposed to be doing your education, and I always tell patients, look for evidence-based material, look for clinical-based studies that can show you, and stop going to the internet and letting people scare you about things and feeding you things that is just not true, especially if they don't have a medical background and they don't work in that specific specialty. So, I just wanted to point that out. I want people to feel good about taking a GLP-1 medication, but I also want you to be upfront and honest with your doctors prior to starting the medicine. And you need to educate yourself on the side effects, not just what they are, but how to treat them. And if you do have comorbidities that require a specialty like an ophthalmologist or endocrinologist, make sure you are seeing those clinicians first to let them know what your plan is, what it is that you want to do, so that they can make sure that these medications get prescribed to you safely and that they're titrated safely so that you don't have those type of issues. So that's really all I wanted to come on and say. I love you guys. Y'all are doing great. This is a really good live. I have my earbuds in, honey. This is so good. And Red, thank you so much for being vulnerable to share that with Kima so that she can give you the support that you need to get through this, girl. We got you. We got your back,
I
girl.
was scared to do it because, when she told me they was online, I was like, Lord, should I do it? I don't want to scare. It was a whole lot that was going through my mind. So I'm just like, just go ahead and do it.
I'm telling you, that's how we help each other. Keisha and I met right here on this platform, and we have become the best of friends. We have a podcast together, but we met right here because of these MEDs. You hear me? And her family is my family is her family. So do not ever be afraid. And I do understand not all platforms are safe. So trust me, go with your gut. I do understand that. But here we have a safe space. We try to help each other. Like I say, I am a certified case manager, and I do help people outside of this app. If it's a doctor that you need in your area, a specialist that you're looking for, because I do have access to tons of resources. So I use what I have to help all that I can. Okay.
So my question is to you before you drop me down on the panel.
Mhm.
What do you think? Because I'm like in the middle. I'm going to a second doctor and I want to get the sleeve, but someone told me if I get the sleeve, I bring the weight back. And I know what you said, what you are. So I'm like, what you think that I should do? Because right now I'm confused. I don't know what to do. I'm just getting tired of the nauseated and all this. So I'm just like, I'm coming to you, asking you for help. Like, what you think?
Okay. So Kima is going to give you Kima's honest opinion.
Okay.
I'm going to talk to you like you my sister.
I'd
Okay.
rather for you to do that than
Okay.
lie.
I'm going to talk to you like you my sister. And what I'm going to say is only you know the struggles that you've had with your journey, going up, down, all the things that you've tried in combination with your medical history. Only you know everything. So what I'm going to say is do not let anyone talk you out of being the healthiest version of yourself. If that's through medication or surgery, you do what works best for you. If the surgery is covered and you okay and you and God and had that conversation and you finally get on that table to get cut, you make sure you ask every question possible, get every resource possible, because it's mental. Okay, it is lifestyle changes about how you look at food. Get to the root cause of what maybe makes you eat certain things that you feel like you shouldn't eat, or what if you have an issue with overeating. Because I don't know, because just because someone's overweight does not mean they have a eating disorder. It could just be stress stuff going on. But we want to tap into the reason behind that. Now, if you can get the surgery and still qualify for these medications, do both.
Okay.
Do both.
Because I didn't know I can do both. So, you telling me a whole lot. So
do both. Okay. Because I am never going to stop somebody from doing what is best for them. I just had this conversation about a week or so ago, and I was talking about my sister had a revision. And as her big sister, I was being very selfish, saying I didn't want her to have it. Not because she didn't need it, but I know my sister. So I had to remind myself, Kima, as a nurse, you cannot tell this patient not to do what they believe is best for them. So at that point, I had to take my big sister hat off and put my nurse hat back on and say, let your sister do what she needs to do for her. So I'm going to say to you, do what you have to do for you, because only you know what you struggle with. Only you know. When people told me to not take these MEDs, once I started dropping, it just gave me the worst feeling in my gut because they were friends, they were family members, because I had a stroke. And when I had that stroke, I was like 180 pounds. So it wasn't obesity, it wasn't diabetes, it was stress that was taking me through that. But don't tell me what I need to do or not do when you have not walked in my shoes. My heaviest 330 pounds. Do not tell me I don't need to take this medication. Do not tell me when I need to stop. I'm gonna stop when my body tells me to stop, because my goal weight was 180, but the medication kept doing what it was doing, and I got down. I'm 144, and in maintenance. I've been in maintenance for 2 years, so I know my body was not ready for me to stop at 180, and I just kept doing what I was allowed to do. When my body said, "Hey, we done," and it seems like we okay right here. It seems like I ain't dropped below that. I might go up in like a 10-pound range, but that's where it's at. So you be encouraged.
Okay.
You be encouraged. If you, again, we can talk sidebar, because I can give you every question that you need to ask the nutritionist, every question that you need to ask the surgeon. I can help you find a surgeon. I can find you some mental health
Please
coaching.
drop me your number in my inbox so
I
I can
will.
call you offline. Keisha, I thank you so much. That's your name?
My name is
Up
Keisha. That was
top.
Keisha that was in here. My sister Keisha.
Okay, what's the one up the top? Because I couldn't see her
Amber.
name. Amber, I thank you so much about I'm so sorry. I thank you so much for letting me meet your name. I'm trying to look because I can't see Keisha.
Amber.
No, that Keisha was at the bottom, right?
Yeah, that was Keisha at the bottom.
And
I'm
you
Kima.
Amber.
Yes.
And Amber at the top.
Okay, and I thank y'all so much about, letting me share my story, and
Absolutely.
please don't forget about me, because I
Girl,
want to
I'm not gonna forget about you. You're gonna be mad when I inbox you first. You're gonna be mad when I hit you up first. Yeah.
I sure appreciate it. Thank
I'm
y'all.
gonna do that. My pleasure. And thank you again, Red, for sharing.
All right.
Thank you. Yeah. And listen, thank you, Kima. When she came in, and again, when I go live, I only know my 9 months, and I know what I've, kind of learned on the journey so far. Again, I'm not medical advice. I'm way far from that. But I'm glad that she came up on the live, and she gave me a little bit more, because again, I didn't even know about the eyesight until we finished the first part of the conversation. And then when she jumped on the screen, it was, hey, I'm like, wait a minute, hold on, but no, I think this is, for me, this type of conversation, being able, we can have fun. Listen, we can go to the meetups, we can do all of that, but really engaging with, our counterparts who are all over the country, all over the world. And I like to say that we're on this journey. Everybody's journey is different, but there is one thing, if I know it's one, we're all trying to get healthier. And so if we can help one another, including ourselves, with mental health, and, we still got to go see the doctors, and we still got to go put in the work. But if we can, have a common space to come and help. And when she was saying she didn't want to scare nobody, listen, I wanted to talk about it, and I can't I know a little bit because I've read. And like I said this morning, I had just read an article that hit maybe the New York Post or something, because there are some lawsuits that are going on pertaining to exactly what, and I read that whole thing this morning. And when she jumped on, I was like, wait a minute, girl, I just read, a little bit about these, different symptoms and things like that. So I'm glad you were able to help, even in its initial stages.
It's absolutely my pleasure. I know my purpose in life is to be of service to others. It took me a long time to admit that and to say it out loud.
Me too.
But I know what I'm here to do, and I'm gonna do that. So I was not intending on going live tonight, but after your live, I said, okay, God, I got you. I'm coming. And I
kept checking back. I was like, she said, and I'm like, oh, she said what time? So I kept checking back or whatever. But no, I'm glad, and hey, she's on the road to, like I said, get a new doctor. Listen, let's talk about the get the new doctor thing, because I tell people all the time, advocate for yourself. Even with me and my PA situation, listen, I had to, you got to advocate for yourself. But listen, this is fun.
Yeah, Kelly, I finished next year. I finish up next year, the beginning of next year, MP school. And Kelly, tell me where you are, because Kelly said this is her specialty. So we can touch base. What state are you in? What state are you in, Kelly? Kelly's FNP.
Is that family nurse practitioner? Is that what that?
She's in Florida, honey. She next door. I'm in Georgia. See,
Okay.
and I be in Houston all the time because
Because you say your sister
Keisha's
is
in
Keisha your
Houston.
sister? Is
Now
Keisha your
my
sister?
real sister's in Georgia. Keisha, my other sister from the GLP1 community, but she's in Houston.
Got you.
Yeah.
Okay. Awesome. Awesome.
So hey, Sophia, and Nurse Rock is in here. Nurse Rock is completing her DNP this year, and she's in North Carolina. Any other nurses in the chat? Hey, Dee Dee, what's going on? Hey, Tara. So definitely, if you are in this live and need to connect, you're in Florida. Kelly, do you have licensure in other states? Let's go ahead and talk about it. Because one thing I know, I intend to be in multiple states. I have a license right now. I'm in 47 states because I am a case manager. So I have patients all over.
So tell me, can you tell us officially, what does a case manager do?
Yep, I help coordinate my patients' care. If they're preparing for surgery, happen to have an accident, go into the ER, and I can have coordinated care when people have accidents on vacations and had to get them from Puerto Rico back to the States. But it's not limited to education, helping with new diagnoses, finding new providers, helping you find resources that are available to cover medications. You name it. I've helped people get surgeries approved that were originally denied. Literally, I am the person's patient's advocate. So I step in as if that's my mama, as if that's my daddy, my auntie, my grandma, and I do all the talking to make sure they get everything that they need without running into any gaps. Because when patients have gaps in care, then we have undiagnosed issues. That's when we are misdiagnosed. That's when our questions don't get answered. When doctors feel like we don't care enough about ourselves to question them, that kind of thing. But I work for managed care companies, so I've done case management in like skilled nursing, post-acute rehab, and in the hospital setting. But now I work from home.
Work from home. That's awesome. And so do you deal with any PAs and things? I'm just curious. I know they heard me say PA, but somebody said that they have a PA coming up. So
yes, I do help people get prior authorizations approved for medications and procedures. So when I tell people that, speaking of like peniolectomy, skin removal, I know what that documentation needs to look like. I know exactly what it needs to say. I know what you need to start saying to your doctor. I know what pictures need to be in those charts and things of that sort. Yes, even when it comes to Zepbound, MJ, like I know what needs to be there. So
nice.
that's what I do. That's what I do. I help people with that.
We all need, a case manager or somebody that knows that, because even with me and with my PA situation, of course, you don't know the ins and the outs until you have to know the ins and the outs. And because I've never had to just fight, or I've never really had a doctor that has had to do a PA for me before, just it's stressful. It's truly stressful and unnecessarily stressful, I'll say. So after several months of trying to get it, but having the knowledge or having someone, on the team that can at least point you in the right direction, hey, this is what you need to this is where you need to start. This is where it needs to end up, definitely goes a long way. At least in my mind, it does.
Let me say there's 115 people in the live right now. If you are new, please make sure you hit that profile picture and follow. Miss Amber is here. You follow her as well. Kelly's in the chat. Keisha's in the chat. Nurse Rock's in the chat. I see a lot of folks in the chat tap in that have been in this community a long time. But let me also say, if you have commercial insurance, do yourself a favor. Most of the time, the member services number is 24/7. Call the back of that, look on the back of your insurance card and call and say, do I have case management benefits? Just ask. And you will be surprised how many of you have access to have your own personal nurse that will do these things for you, but you don't know if you don't ask. So get that card out and call and say, do I have case management benefits? Because most employees pay for it. It's an added benefit employers pay for, with the intent of keeping people out of the hospital, out of the ER. Because at the end of the day, the insurance company wants to minimize what they have to pay out. But if we're going to have to pay it, we need to make sure everything lines up, you know? So I give an example. I had a member scheduled for surgery on Monday. He got in contact with me Friday at 7 p.m. Eastern Standard Time because he had just found out his surgeon had become out of network. His surgery is Monday. It is Friday night. And I'm trying to get off early. So what am I to do? But I reached out to my medical provider, my medical doctor, and said, hey, this is what I got going on with this member. I know this is not necessarily one of your clients, but I need some help. You know, it's 7 o'clock at night. This man is scheduled for surgery on Monday morning. Like he had to be there at 4 o'clock in the morning. It's 7 o'clock. How can I help him? And he's 2 hours behind. How can I help him? And my medical director reached out, got in contact with the powers that be, that went in and allowed that surgeon to be in network long enough to complete his surgery and do the follow-up appointments.
Man, that's awesome. That is awesome. That's God, and that's
Somebody that's
awesome.
gonna work with you now. Because I will call whoever I got to call for my people. I will. You know, that my direct uplines always say, Kimmy, you are the sweetest. The way that you nurse is different. It's like you nurse with compassion. Like you do everything you absolutely can. Like you don't stop until they got to tell me, Kimmy, we done did all we can do. Yeah. Before I drop the ball and be like, all right, I'm done. But I will work late. I will come in early. I will do all the things. So I say all of that. Reach out to your insurance and find out if you got a case manager. Okay? Because we have case management where we manage while you are in the hospital, when you leave the hospital, and you don't even have to necessarily have a need to have surgery. If you just, life is lifing. And you can't schedule your appointments. I schedule appointments for people. I call in refills. I schedule pickups and drop off. I do whatever my patient need me to do because I don't want them to be sick. I don't want them to have to go to the hospital. Flip over the back of that insurance card. Tell them, Toya, flip it over and call. And you would be surprised. Okay? But thank you all for joining. If there are any other questions for Miss Amber, please feel free to drop them in the chat. Because I know Miss Amber had her own live. I ain't gonna hold her down. I don't want to hold you hostage.
I'm just glad that she is on the road to, really getting, the answers that she's wanting, since her doctor is kind of just really pushing, pushing the titration and all of that and things and not really listening. So that's the unfortunate piece.
They are giving her what they think she needs based on one aspect of her life. Right. What they can see. They are not listening to what she's complaining about.
And I'm guessing that if they keep going up, then of course she'll shed the pound, the LBs, and then with that will ultimately decrease the A1C and things like that. So then she'll be all fixed and good, but it's creating other issues.
My A1C lowered by, I want to say, by the time I hit 5 milligrams, I was under 5. And I noticed once my A1C got under 5, and it was never like high, I was never considered diabetic, but my cycles normalized. I was no longer having extreme pains, irregular periods. The mood swings, honey, that I had going on, all of that stuff was like happy life all the way around. About 4 months in on the journey, it's like everything just clicked and aligned, and then LB started doing, skin just glowing. I'm bopping around. I have all this extra energy to work out. Let me see.
If I can get my cycle to straighten out however yours did, praise the Lord, because everything else is fine.
Dee.
Hey, I just want to come back in. Lord. I just want to come in and say this. Hey, Amber, you new to the group? Yeah, I've been in this community since 2022. So yeah, Kima know. But Kima, I also want to say not only case management, your insurance will pay for for a dietitian and a nutrition. And then also cause I've been sleeved, and I'm also on a GLP1. So I was like, dang, I wish, I want to tell her so bad, if that doctor's not listening to you, move on to another doctor. Don't be scared to get more than one practitioner up under your belt, PCP up under your belt. I had a few things else I want to say, but that's what I want to say. Kima, I know you got it.
No, go ahead, Dee.
Yeah.
I just realized, Dee, you sent me a message about a dinner or lunch or something.
Yes, you're in Houston?
Yes. Yeah. Okay. I'm like, I know
yes,
this name.
Yes. Right. Yeah, we all just be trying to meet up in Houston and just be having lunch and brunch together and just do our own little thing. Not saying nobody else can't come. We just be, doing our own.
Because I'm having the thing on Saturday. And I was like, why do I know this name? But I remember you sent me a message the other day.
Yes. And then we got that crazy weather. We weren't expecting that. Yes. But we are going to be planning something soon. We just trying to get a date where, because, I said the 8th, but then that's the Super Bowl. So I'm like, nope, that's out. Yeah. Yeah. I know, right? Yes, that is out. But I'm still trying to work on I'm kind of in maintenance. I want 10 more pounds than I will be. To me, I would be in maintenance. I bounced between 165 and 170. I started my weight loss journey at 341. So if you go back and look at my pictures, y'all can see where I was real big. And but yeah, I'm just trying to be getting this panulectomy. I'm like, dang, hopefully it's my time, but I'm kind of scared now.
Why?
What is that? What's a panulectomy?
The panulectomy, the skin removal.
Oh, I want that. Yeah, I want that too.
I'm planning to go back because I need, honey, I ain't scared.
I'm thinking pain, but yeah, the healing, because I know you healed so easily though, Kima.
I did, but I feel like that was because of the NAD and glutathione. I was taking it before surgery, and I continue to take it after. Like my first jab after surgery was 3 days after the fact, and it was the NAD and glutathione. I wasn't thinking about no tirzepatide. I was thinking about the healing.
Yeah. Yes. But yes, I just want to let anybody know that, this journey, like I said, I'm going on year 4 of Mounjaro. I just only been on brand name. Thank God I never had to switch to compound because I am a type 2 diabetic. But, when I started this journey, my A1C was 11. Now it's at a 4.8. I can't ask for nothing better.
That's right. Come on.
4.8. I'm like, what? So I love it over here. I don't go live. Remember we used to go live all the time. Remember we started the lives, but yeah, I don't even say, but I just don't get the chance to go live. My work hours is so crazy.
Yeah, this was definitely, this month has been a challenge and a commitment for me. I had to really plan out what school schedule, my work, my family time, because I said going into 2026, I am making like more time to spend with my daughter, more time for my husband, not just because we're all watching the TV together, but dedicated time where he and I are together, my daughter and I are together, and then being able to still uphold my obligations here on social media. So it's definitely been a challenge, but I thank God I made it.
Yeah.
Next month we're gonna take it 1 month at a time, and we'll keep on keeping on.
Yes. Yes, I already know what you're doing is a lot of work. So that's why every time I see you post something, I'm like, we praying for you. We praying for you. Keep it going. Keep it pushing. So I'm just going to support you.
Absolutely. Yeah. And I love it. I love the family that I have met right here. Like I said, social media on this journey, just because of one medication, I have met tons and tons of people and have built wonderful relationships. We talk outside of this app. So
yes. And your sister from Florida, she reached out to me.
Which one? Twin? Shantae?
Yeah, twin reached out to me and I gave her my address. I'm like, hey, use my address to get, some resumes and they get a Houston address. So so I gave her, we talked. So,
I told her, I was like, hey, this is who is in the area. Cause I love me some Houston, but I was like, there's other places outside, but yes. So I'll be in Houston in April. I'll be there in April.
April what? Which one?
The second week in April. At the Easter weekend, I'll be flying in.
Okay, we probably can try to do a brunch. Y'all want to try to meet up and do a brunch or something?
I want to
You
see
do
you
whatever
face
you
to
want to
face.
do. I'm
We'll
be there the whole week.
Okay.
Okay, yeah, we can try to do something. I'll do a quick meetup. Yeah,
Okay.
Nice.
yeah,
Well, thank you, Dee Dee, for
yeah.
coming up and
Okay,
sharing.
yeah, not a problem. I just want to share, about that insurance because I work in insurance. So yeah,
Yes,
so
that's right. I
do
forgot. You sure do. Yes, you do.
yeah,
You
so
and Renee.
yeah.
Renee do something too with insurance, right?
Renee work at the doctor's office. Yeah, but
Okay.
yeah,
Okay.
she knows all of that. Yeah, she
Okay.
knows all of that. Alrighty then, yeah, and don't forget to pray for Mo, for Mo's son. Did you see
Yes.
that? You see it?
Yes.
Okay,
Yes.
all
Yeah.
right,
I saw that.
alrighty. Well, love y'all, and I will
Love
be
you too,
talking to y'all
Dee.
later. Okay,
Okay.
bye. Mhm.
Bye.
Okay. Side to side, I saw your eyes. Yes, I am going to Houston. I know I have not discussed this with my moderators, but I will be in Houston. I'm going to stay with Keisha for a week while my daughter is on spring break with her grandma. Okay? So we all know. And I will be in Houston. Look, I know Kendall. I'm going to be there. I promise.
Now, KG is in Houston, right? Is that the
Yes.
same KG that I think that's in Robbie's live? I'm trying to
Yes,
associate
that's
people.
her.
So, okay.
All my Houston people, tap if you're from Houston in the live right now. It's 83 people in here. Drop in the chat, Houston. Okay,
Yeah.
H-Town. Hey,
H-Town,
BW, what's
baby.
going
Listen,
on?
got my Astros always.
I will be there. I'm gonna make my rounds. So we got the meet up here in Atlanta, which of course that's easy for me. I'm here.
Coming. I'm gonna try to make both of them. I'm gonna try to make Dallas as well. It's a drive,
Me too.
I just got to get on the freeway for me. So, and then I want to do some things here in Houston. Actually, as a matter of fact, I have something on Saturday, but I want to start doing stuff, and yeah, it's what I do. Being in radio and being in media and all of that. So just kind of meshing all of it together it makes sense.
Absolutely. And we need to touch base because Keisha and I need to do a health fair in Houston. So we need to kind of touch base to get that piece together because we did one up here in Atlanta, but we need to get to Houston. So
Sounds good.
ATL shawty. But thank you so much, Amber, for joining. I appreciate you so very much. But I'll reach out and give you my number too.
Yes, I'll do the same. But no, thank you so much for just coming up briefly earlier, sharing the information, and then doing this to kind of just for people that don't know about the connection or non-connection or whatever. But yeah, but thank you so much for even taking it the rest of the way. I appreciate it.
My pleasure. Thank you, Amber.
Grad student at Texas Southern, but in California. Shout out. I work at TSU. So yeah, awesome. So yeah, good deal.
Okay. All right. Thanks, Amber.
All right. Thank you so much, guys. Y'all have a great night. Y'all be safe. I don't know.
All right, y'all. That was so informative. So thank the ladies for coming up. Thank them. Thank Amber, Red, Keish, Dee Dee. Appreciate you. Yes, there is an Atlanta meetup. I will be there in June. I'm darn sure gonna try to make the Dallas meetup in October for sure. And then of course I'll be in Houston in April. There you go. Thank you, Toya, for posting that. Does anybody have any other questions? If there's someone in the chat that wants to come up and share, definitely let you do that. I used to do that on Friday nights. Open up the space for people to come up and share their share their experience on GLP-1s and all the things they want to talk about. So if there's anyone that wants to, all you have to do is hit that request button and you can definitely come up and share your story. My healing journey, I done healed fine. Dee Dee, I have healed fine. I'm telling you, by 5 days post-op, my scar was healed. It's flat. I'm still treating it. I still put my cream on at night. I still do that. And I do mix my creams. So I have the Royal Alchemist body oils. It has the squalene in it. I mix that with my body glaze and my scar cream, my Moderna scar cream. And I make it real thick. And that's what I put on my scar every night. Okay? I sure do. Thank you for the heart, me, be Will. Thank you, sis. So if everyone's in the life, if you're not already following, make sure you hit that follow button and turn on your notifications. Tonight was just an example of the type of information that I try to bring and share with the community. And a lot of times it's just based on a question that somebody might have asked and we want to expound on it. So again, do not be afraid to DM me, even if it's a situation that might not be going on with you, it just might be going on with somebody else and you just want us to talk about it. Send me a message and we'll get into it. We will definitely get into it.